thank everyone on behalf of Benefit Express for joining us this afternoon for our Administering Health and Welfare Plans. It's all of your common compliance questions answered today by our trusty ERISA attorney, Larry Grugine. Thank you, Larry. Our next one is coming up in almost 3 weeks. It's COBRA administration issues and how to fix them. And that will be on Tuesday, April 5th at 1 p.m. Central Standard Time. And you can register for that at our website. I'll also send you the link through the chat box in a little bit. I sent everyone the slides via email that you registered with. So just make sure you type your email in correctly when you sign up, because that way you'll get all the information you need. It's also in the handouts tab of your GoToWebinar toolbar if you'd like to print it now quickly. It's going to be mostly a question and answer session today, so it might be helpful to have that in front of you just so you can take good notes. And we're going to go ahead and keep everyone on mute because we do have a high volume of participants today, and then Larry will pause several times for questions. If you'd like, you can also ask your question through the questions tab in your GoToWebinar toolbar, and I'm happy to ask it on your behalf and receive your answers. I think that's all. I'll have Larry start.
A couple things before we begin. First, that COBRA seminar that I have next week is a brand new seminar, brand new, and we're going to go through at least 15 or 20 common COBRA mistakes in the administration of COBRA. So I think it's real important that you attend that, because it's going to tell you what are some of the common mistakes and how to fix them. Also, as I indicated earlier when I was chit-chatting with Stacy, is this seminar, probably 95% of the questions are brand new. We've done this seminar in the past, but I've come up with brand new questions, and these questions that you see here are based on situations and questions I've been getting from my clients in my practice. So these are not hypothetical questions or philosophical questions. These are actual client questions that I've been getting in my practice over the past 6 months to a year. So let's go through them. And this presentation is divided up into various areas: ERISA, COBRA, HRAs, CAFETERIA plans, HSAs, and ACA. So, and after each of these sessions, I'll stop for questions. Now, as Stacy indicated, if you want to think about your question and send it to Stacy, go into the toolbar and type in your question, send it to her. And when we have the question tabs, I'll take those questions first. So let's go through the questions. Under ERISA, do not-for-profit employers have to comply with ERISA? And the answer is yes. This is a very common question I've been getting. And there's only a few types of employers that don't have to comply with ERISA, and that's the second question: which employers don't have to comply with ERISA? There are two types: of governmental employers and church plans. Now, for those employers, they can pick and choose which aspects of ERISA they want to comply with, and many of them, for example, choose to comply with the claims procedures, because they want to give employees a procedure how to file claims and how to appeal claims. So for those types of employers, governments and church plans, they can decide which aspects of ERISA they want to comply with. So, for example, they don't have to comply with the summary plan description requirements. Their summaries don't have to meet all the requirements that private employers and also not-for-profits have to comply with. Can an employer have different renewal dates for benefits contained in a wrap plan? Why is a plan year should be so important? Now, in this situation, what you can do, you can pick a plan year for and a wrap plan is a plan that wraps around all your different types of benefits. And many times employers do that for a wrap plan for a number of different reasons. And one is to consolidate your 5500 filings if you have a number of 5500 filings. The other is just to organize your benefits. Now, wrap plan just wraps around all your benefits. Now, if you're 100 or more participants, the plan will determine when you file your 5500, so that's important. but you can have different renewal dates and different benefits underneath that wrap plan. You can have a medical plan, you can have a dental plan that has different renewal dates contained therein, and that's just reflected in your 5,500 requirement. But a plan year is extremely important for one reason, is the fact that many of the ACA requirements for medical plans are based on the ERISA plan year for your plan. Now, if you don't have a wrap plan, that's going to be your renewal date on your medical plan. If you do have an ERISA plan, one thing is extremely important, which you want to do is have your wrap plan and your medical plan have the same plan year. So therefore, because many of the changes under ACA are reflective and under the plan year for the plan, so you don't want to have an ERISA plan year that's different than your renewal date and your medical plan. When is an employee assistance plan or a wellness program subject to ERISA? And this is a very common question I've been getting. I've had arguments with insurance companies and different providers in regard to this. And there's a number of different guidance from the Department of Labor on this, and especially on employee assistance programs. There's a number of different DOL rulings on this. And basically what they've indicated, especially with employee assistance programs, is that it's based on whether the employee assistance program is considered to be a medical plan under ERISA. And what the DOL has indicated in past rulings, that if an employee assistance program provides services beyond a referral, in other words, there's a nurse helpline, employees get so many counseling sessions from the employee assistance provider. I reviewed a ton of these. Some are very sophisticated, others are very simple. But if it provides services beyond a referral, and most of them have a nurse helpline, then that employee assistance program will be considered to be a medical program under ERISA. Why is that important? That's important because of the fact that what you'll need for that employee assistance program is you need an ERISA plan document, you need an SPD, and if it's a medical program under ERISA, then basically what you need to do, it has to be provided under COBRA. So it becomes very, very complicated, and many employers are not doing that. So again, if your employee assistance program provides services beyond a referral, and many of them are embedded in a insurance program, or they're embedded in a disability program, or in a AD&D program. The insurance company provides these additional services. Well, again, depending, and many times these insurance companies are contracting with other vendors to provide these services as an add-on. And they don't really understand that once you have very sophisticated services inside the employee assistance program, it comes in all different legal requirements in this situation. Next, how about wellness programs? The guidance on the wellness programs are not that sophisticated, and it's based on a letter from 1994, and basically what the DOL has said on that is that if a wellness program provides diagnostic testing and other services inside the wellness program, again, then it becomes a medical program under ERISA, and especially if you have a freestanding wellness program that contains other services such as disease management services, then that is, and basically what I tell people, if you have a participation-based wellness program where you just give money to employees because they attend a smoking cessation program or they attend wellness programs, that technically is not a medical program under ERISA, and therefore you don't have to offer it on a COBRA. But as soon as you get an outcomes-based program, you get inching closer and closer to being a medical program under ERISA, and therefore COBRA comes in therefore, you may need a separate document, a plan document, and an SPD for that wellness program. So again, depending on what your wellness program looks like will depend on whether all these different requirements come rushing in. This is a very common question I'm making. Can an employer put the name of the plan on a checking account? And I would advise against it. Because the significance of that is that as soon as you separate funds out, as soon as you put the name of the plan on a checking account, basically what that means is the DOL considers that plan to be funded. And if it's considered to be funded, then what happens is then all those funds have to be held in trust. So as soon as you separate funds from your employer's assets, under ERISA what happens then, those funds have to be held in trust. It's considered to be funding, and therefore even for smaller employers, it may trigger a 5,500 requirement. So what happens if the employer does that? Again, the plan now is considered funded, and therefore you have to set up a trust to hold those assets. Now, does a plan need to be funded? And the answer is no. Many employers don't separate funds out in the name of the plan. And many larger employers and some medium-sized employers do so to create a reserve, especially if you're self-funded. And there are advantages for being funded. You can set aside more funds for being, you can create a reserve and get a higher deduction if you're funded. But is it a requirement that you have to be funded? No. But if you are, ERISA requires, again, that those funds be held in trust. What is the penalty for not filing 5500s? The penalty for not filing 5500s are $1,100 a day for not filing it or late. So it's a pretty hefty penalty. Now, please remember that the DOL provides a delinquent filer program that substantially reduces the penalty. So all you have to do is file the returns, and there's one address to file the delinquent returns and another to file under the delinquent filer program. And in some situations, that penalty can be reduced down to only, for a number of years, down to $4,000. In some situations, it's $10. It goes from $1,100 a day to $10 a day. Also, what's extremely important is the fact there's no statute limitations on not filing at 5,500. So the penalties just continue to mount. So that delinquent filer program is a great device. If you discover if either you or one of your clients have not filed returns, that delinquent filer program substantially reduces the penalty. And this is something you should use in order to, again, and this comes up many times for employers on not filing 5500s, especially in mergers and acquisition situations, when all of a sudden you have to present all your warts in front of a buyer, and they see that you haven't filed your 5500s. And many times this comes up, especially if all of a sudden you're inching up to having over 100 participants in a plan, and 2 or 3 or 4 years transpire in that situation. And then all of a sudden you realize, oh my God, I should have filed a 5500 years and years ago. And that's where delinquent filer program comes in. Now, one other aspect, and I'll be discussing this in a few minutes, that's extremely important, is that the delinquent filer program only applies to 5500s. There's another form, if you would consider, and I'll be talking about a ME1 in the next few minutes, what that is, a multiple employer welfare arrangement. If you let in, for example, unrelated employers in your medical program, that's considered to be a multiple employer plan, and there's nothing wrong with that, but you have to file an M1. The problem with that is the delinquent filer program doesn't apply to M1s. So there's another $1,100 a day penalty if you haven't filed your M1s. But that only applies if you have what's called a MEWA, which I'll be discussing in the next few minutes. That's the next slide. What is a MEWA? A MEWA is a multiple employer plan that's not a union plan where you have unrelated employers participating in a plan. How could that come up? A situation many times when you're in certain industries, especially the restaurant and hotel industries, where each separate property could be a separate corporation, separate and different investors. And all of a sudden they say, well, let's all participate under one medical program. Well, when you have unrelated employers participating in a medical plan, basically that makes it a multiple employer welfare arrangement. And those arrangements are regulated by the states. And in some states, like Ohio and Florida, you have to be members of an association to do it. In Illinois, you can have a multiple employer plan, but it can't be self-insured. And the reason why states do regulate this, because it's seen as a dodge to the insurance regulations. There are scandals in the 80s and 90s where people set up these MEWAs, enticed employers to join. They were self-funded, and they were fraud. So, again, it was decided the states would regulate that. And, again, some states have very stringent regulations, others do not. And some states only allow certain entities to enter into a multiple employer arrangement. So what does it apply to, I should say, when does it apply to employers? Again, if you have unrelated employers, now where this could come in is if you have, for example, 1099 employees participating in your plan, because those are not employees, they're unrelated businesses. And when is one created? Again, if you allow them to participate under your program. Stacy, do you have any questions?
Yes, I have a couple, and then I will open it up for questions. When are AFLAC plans subject to ERISA? Should they be included in the WRAP document?
In the voluntary, there is a voluntary benefits exception to ERISA, where if you have voluntary benefits, it's not subject to ERISA. Now, the only catch-all phrase, and that if your employer doesn't endorse it. What does that mean? It means they don't promote it, don't choose the insurance company, and one way that an employer can endorse a AFLAC policy, and the DOL sees that, is if you make the contributions to the AFLAC policy pre-tax. So as soon as you make the AFLAC premiums pre-tax, is seen as an endorsement of the premiums, and therefore it'd be subject to ERISA. Okay. So as long as the employer, as long as you make the contributions to AFLAC policy post-tax, I don't think there's it would be subject to ERISA. But as soon as you make it pre-tax, I think it goes a long way of indicating that the employer has endorsed the policy by letting employees contribute to the plan on a pre-tax basis.
Okay, then just an add-on to that, would AFLAC then be subject to the formal claims procedures?
Yes.
Okay. Next question, is it accurate to say that if the EAP that offers counseling services and is embedded in the LTD plan, it is subject to ERISA and COBRA? Correct.
And what you need in that situation is you need a separate EAP plan document / SPD.
Again, add on to that one, can an EAP subject to ERISA be included in the employer's health and welfare WRAP plan document and WRAP SPD and not a separate plan doc?
But what you would need, you need as an attachment to the WRAP, you need a separate EAP document. So what I usually do in that situation is create a separate EAP plan document / SPD.
Okay.
It's only about 10 or 15 pages because you need something that, see, many times with these EAP programs, the employer is given a summary sheet that's a page or two that describes the benefits. That's not good enough. And if you look at the actual insurance contracts, there's a mention of these EAP policies and procedures. There's nothing in there.
Okay. If you allow 1099 workers into your plan and it becomes a MIWA, what does that mean for compliance issues?
It means, one, you have to file an M1. One. Two, if you're in the state of Illinois, it can only be, the MIWA can only be insured. It cannot be self-insured. If you're not in Illinois, each state has separate regulations on that. In some states, you have to register. In other states, there are limitations in who can actually sponsor a MIWA. So if you operate in another state, you have to check the state statutes. Some are very stringent, others are very lackadaisical. So again, for example, in the state of Ohio, only associations can sponsor MIWA. So again, depending on what state you're in, the rules can vary. And others make MIWAs subject to the same rules as insurance companies, because they see it as a dodge to the insurance companies. So again, be very careful.
Okay, last question. Is a self-funded medical plan with a plan year different than fiscal year subject to a separate audit?
Well, the fiscal year, remember, and that plan year is established by the ERISA plan document. And that basically determines when you have to file your 5500. So you could have an ERISA plan year, and then underneath the wrap document, you could have different renewal dates for your different benefits. As I indicated before, be very careful in that, because your plan year for your ERISA plan document should be the same as your medical plan, because ACA, all the changes are triggered on the ERISA plan year. Hopefully I answered your question. If I didn't, why don't we open it up if I didn't answer your question?
Yep, sounds good. Okay, I'm going to unmute everyone for questions.
The conference has been unmuted.
Anybody else have any questions? Anyone else?
No one. Okay, let me mute, and then Larry, I'll unmute you.
The conference has been muted.
One area that's extremely complicated, and next week I will go into more detail on this, but COBRA is extremely complicated, convoluted, and there are issues that many times employers don't realize. A very common question I get is this first one right here. Can qualified beneficiaries add benefits at open enrollment? And the answer is yes. When an individual is a qualified beneficiary, they have the same rights as any active employees. They have special enrollment rights. So at the qualifying event, you're only supposed to provide coverage to qualified beneficiaries to what they had at the qualifying event. So if somebody just has dental at the qualifying event, initially you just offer them dental. But at the next open enrollment, that qualified beneficiary has all the rights as any other active employee, so therefore they can add medical, they can add vision to their benefits until the end of the COBRA period. So again, this is something that many times employers don't understand, that again, you have to treat qualified beneficiaries just like any other active participant. If coverage ends for retirees, can the employer have to give them the right to elect COBRA? And the answer is it depends. Because at the time of the initial qualifying event when they terminated employment. If you're an employer that you have a retiree medical program, and basically if the terms of the retiree medical program are different than the active, in other words, the retiree pays a different premium than the active employees. Many times they'll give them a deal, but not as good as an active participant. That is considered to be a loss of coverage, and therefore it triggers a COBRA notice. So as an employer, if that's the case, and you give the employee a choice between the retiree coverage and COBRA, of course they're going to pick the retiree coverage. If you do that, and the employee does pick retiree coverage, then when the retiree coverage ends, usually at Medicare, or turns into supplemental coverage at Medicare, you don't have to give, again, that retiree a COBRA notice at that time when that retiree coverage ends. Now, at the time of the initial qualifying event, which is retirement, if you did not give them a COBRA notice and give them a choice to electing COBRA, when that retiree coverage ends, then you would have to give them a COBRA notice and offer them COBRA at that time. All right? If an employee drops coverage, just drops it, does the employer have to offer his or her spouse COBRA? And the question is, and this is a very common question, remember, there has to be a qualifying event and a loss of coverage. If you just have a loss of coverage, in other words, that employee decides on their own at open enrollment to drop their spouse, and there's no divorce, no termination of employment, no reduction of hours, there's no qualifying event, does the spouse have any COBRA rights? And the answer is no. And I get this question time and time again because people are confused. Well, there's a loss of coverage, and therefore it must trigger a COBRA notice. Well, the answer is, well, the second question is, what's the qualifying event? And if it's just a loss of coverage without a qualifying event, then it doesn't trigger COBRA coverage or COBRA notice. So this is a very common question I get. Can a COBRA participant drop coverage at any time? And generally the answer is no, but the way they can accomplish a termination of coverage is not paying the premium. All right? So again, if a COBRA participant doesn't want COBRA coverage anymore, they merely don't pay the premium. But technically, that's not a that's a termination because of not paying the premium. It doesn't, again, mean that the COBRA coverage is officially, they're dropping it. It just means they haven't paid the premium. So again, there's ramifications behind that. Can an individual pre-tax COBRA premiums? And again, as long as there's group coverage, and many times you hire someone who says, I have great coverage from my previous employer, and my doctor is on the network of my previous plan, and I want to continue my coverage till it's over. Can you allow me to do it? Well, basically what you have to do, one, you have to make sure it's group coverage, and two, your plan has to permit that. You have to amend your CAFETERIA plan to allow COBRA premiums. So again, many plans do not allow that, so you have to amend your CAFETERIA plan to permit that. Stacey, are there any
Yes, I have
questions?
two. I have two. Do you offer HRA COBRA separately, or should the premium be integrated with the group health premium?
Well, most it's your choice to do that. Many employers say you can't take one without the other, but I don't think there's a requirement that you have to do both. But you can make a requirement that you have to elect one with the other.
Okay. If COBRA terminates due to lack of payment, can they enroll in the marketplace?
No, you have to. That's the situation I was thinking about. No, because they haven't lost eligibility. That's the issue.
Okay, I'm going to go ahead and unmute.
Now, with
The conference has been unmuted.
What marketplaces have been doing has been citing hardship. So, all right. Does anybody have any questions?
I never heard of it.
Anybody have any questions?
The Rainbow Bridge and you cross.
Anybody have any questions?
Yes,
Yes.
I do. So my question was regarding the HRA.
I can't. Somebody's talking. Could you? Somebody's talking over you. Okay, why don't you start again?
I mean, they did so much. And they did the same thing for Lady. I only had Lady 8 years, but that was still hard. But he was with me 16 days.
My question was the HRA COBRA question, and do you offer it separately or the premium? And this has sort of been something that we have vacillated on, because don't you have to give employees the option of opting out of the HRA? And if you build the premium in, I don't know how you accomplish that.
Yeah, but it's got to be a yearly thing that you allow them to opt out. So you're correct on that. I mean, but I mean, I think in that situation, you can say, well, if you don't take, you can opt out, but if you don't take the HRA, you can't take our medical program.
Okay.
That's something that may solve it. I would have to think about that, but that's one solution to the issue.
Okay. Thank you.
Any other questions? Anything else? All right, Stacy.
Okay.
The conference has been muted.
A lot of questions on is HRAs. Is an employer allowed to limit the type of benefits that it reimburses under its HRA? And the answer is yes. Now, because it's employer money, the employer can design an HRA to reimburse any expense at their discretion. In fact, what some people do, they design their wellness programs as a form of an HRA, tied, again, integrated with the group health plan, but they want to generate certain activity and reimburse certain expenses. So because it's employer money, and this is the major difference, I think, in this situation between health FSAs and HRAs, because under an HRA it's employer money, the employer has much more discretion about what they want to reimburse, as opposed to a health FSA, which you have to reimburse those expenses that qualify under the Internal Revenue Code. So the employer can be very specific in what they're going to be reimbursed. The most common design for HRAs is the fact that the HRA again has to be offered with the group health plan, and many times the way the HRA is designed, and the easiest way to administer an HRA is to say, okay, we're going to design the HRA to reimburse those expenses that would have been otherwise reimbursable under the group health plan, but because of coinsurance and deductibles. And what that allows the employer to do is simplify administration by having the employee just provide them with an EOB indicating that the plan would have reimbursed it, but they're not doing it because of deductibles and co-pays, and therefore it's much easier to administer. Can the employee participate in an HRA if he or she is not covered under another employer's group health plan? Can an employer participate in if he or she is covered under another employer's group health plan? Yes, you can do that. It's a little tricky, because one of the fears that many employers have in this situation is there going to be a double dip? Is my employer going to submit expenses under this plan, and unbeknownst to us, they're going to get reimbursed that same expense under that employer's plan? And that's why many employers don't want to do this, because the possibility of fraud increases. How are you going to guard against a double dip? And therefore, you're paying for an expense that another employer also pays, and that's something that, how are you going to find out that's the situation? Whether that employer has their own HRA that the employee is using, that the employee's spouse is using, for example, and therefore you're paying for the expense twice. So that's why many employers are hesitant about actually having this design. How does information and reporting apply to HRAs? Are there separate reporting? And this is a very common question I'm getting in the final instructions to the 1095 indicated this, and as long as the plan is integrated with the group health plan, there's no separate reporting. The only time you have to separate report is, again, along with the past slide, is if you allow individuals that are participating in the group health plan to participate in an HRA. And when I'm advising clients to do in that situation, if you do allow that, basically you give that employee a 1095B. Can the employer limit the amount it reimburses to participants on a monthly basis? The answer is yes. Again, because it's employer money, you can limit, unlike at health FSA where you can't limit what the employer is going to receive. Here you can say each month we're only going to reimburse expenses up to a certain level. So if you get a big expense, I'm sorry, but we're not going to reimburse it all at once. So an employer can put limitations of how much they're going to reimburse on a monthly basis. What is the penalty if an employer reimburses individual premiums under an HRA? The penalty for each employee is $100 a day. So please be very careful in that. There's some entities out there that are still touting this as a way of designing your health plans. Be very careful, because under the law you're supposed to self-report on yourself, and if you get caught, the penalties are rather severe. So again, you cannot reimburse individual premiums under an HRA, and if you do, the penalty is $100 per day per employee that you're allowed to do that. Stacey, do we have any questions?
Yes. First question. Don't you have to give employees the option of opting out of the HRA?
Yes.
Okay. If the premium is built in, how would you accomplish this?
Well, you can say to them, you have to pick. You opt out if you opt out of both. You opt out of both of the HRA and the group health plan. So we'll allow you, but we're not going to allow you to just opt out of one versus the other.
Okay. Next question. If your HRA is integrated with another GHP spouse, does the 1095B have to list all the dependents who could potentially receive reimbursements?
Yes. That you are correct on that.
Okay. Okay, that is all the questions I have. I'm going to go ahead and unmute it. Just be conscientious, everyone, of talking, and maybe put us on mute if you're going to, but don't put us on hold. Thank you.
The conference has been unmuted.
Anybody have any questions? Anybody?
Okay.
Okay. Another area that
The conference has been muted.
What is the impact on a health FSA, if the employer allows an employee to participate in a group health plan and he or she is not eligible to participate in the employer's group medical program. Well, basically, what you've done is you make the health FSA a non-accepted benefit, and therefore you make the health FSA subject to ACA. So there's an exception for health FSAs from ACA, and there are two requirements. One, there's a limitation of how much employer contributions, up to $500. And two, the second one is that the health plan must be made available to the employee. It doesn't mean they have to participate, but made available. In this situation, the employee is not eligible. And this has come up just recently to me, where some employers allow part-time people to participate under the health FSA, but they don't allow them to participate in the group health plan. Basically, it blows the exception. They're no longer an exempted benefit, and therefore then the health FSA would be subject to health care reform. So what does that mean? It means now that you have to provide unlimited preventive care under the health FSA. Can a cafeteria plan contain different eligibility requirements for different employee groups? Under the proposed regulations that came out in 2007, that would technically be a violation. But since the regs are just proposed and not final, the employer doesn't have to follow the proposed regs. But what you're doing is you're complicating the administration of the plan, because you would have to run different eligibility tests for all the different features under your plan. So that would complicate the administration of the group health plan, because you have to test to see if each different eligibility requirements meet the eligibility test under the cafeteria plan. So again, it makes the administration of the plan slightly more complicated. What is the impact if the employer allows employees to pre-tax voluntary benefit premiums? We had this question earlier. Somebody asked that question. And basically, as I indicated earlier, it's one of the factors to consider whether somebody has endorsed the voluntary benefit. And under the voluntary benefit exception under ERISA, if the employer endorses it, then that voluntary benefit is then subject to ERISA. So that's the impact of allowing pre-tax contributions of voluntary benefits. Can an employee be allowed to drop coverage during the year if he or she deems it unaffordable? This is a very common question that many employers ask me, and that's not one of the qualifying events under the cafeteria plan rules. So just because you deem it unaffordable. Now, one of the things that come close to the situation is that if you have a situation where somebody is a full-time employee, variable hour employee becomes full-time, then their hours drop. Under certain situations, you can allow them to drop coverage if they go on the exchange. So that's one exception to this, but only if their hours drop, not because somebody says, I thought I could afford it, but I can't. I have additional expenses, their hours didn't drop. Technically, it's not a qualifying event under the cafeteria plan rules. Is an employer required to provide an SPD to participants in a health FSA? Yes. So again, a health FSA is considered to be a medical program subject to ERISA, and therefore your summary that you give to the employees must meet all the SPD rules under ERISA. So please understand that. Are there any questions? Stacy, you have any questions?
I have one. Are Section 125 plans required to mention on the enrollment forms language about lowering Social Security benefits? Or is it just a good idea?
I think it's a good idea. I think it should be in the SPD, not the that should be in the SPD, not in the enrollment form or the election form.
Okay, and that's all the questions I have. I'm going to unmute.
The conference has been unmuted.
Anybody have any questions? Okay, why don't we mute people again?
The conference has been muted.
Is covered by a high deductible plan. He also covers his spouse. His spouse has other coverage that is not a high deductible plan. Can he contribute the family limit? And the answer is yes. The person who contributes to the HSA can't be covered under any other group health plan. But the spouse is ineligible, but it doesn't make the employee ineligible. We have to make sure in this situation that all the HSA money is contributed to his HSA only. So the family limit is made entirely to his account. And since she is not eligible to establish an HSA, she cannot have an HSA account. But just because she is ineligible doesn't make him ineligible, and he can contribute the full amount. An employee covers himself, his wife, and their sons age 21, 22, and 24 in the high deductible plan. He does not claim his sons as a tax dependent. Are his sons eligible to contribute to their own HSA? The answer is yes. How much can they contribute? Up to the family limit, because they're covered by a family plan. So each of the sons, aged 21, 22, and 24, can contribute the full family limit, and the employee and the spouse will have another family limit. Now, can the employee reimburse his son medical expenses from his or her HSA? And if they're not a qualifying relative, then again, under the tax rules, he cannot reimburse his son's expenses tax-free. They have to qualify as a qualifying relative or qualifying child in order to be eligible to receive tax-free reimbursement. But again, this is a very common situation where the three sons are covered under the group health plan because of the age 26 rule, and since they have family coverage, now we have 4 family limits in this situation. One for the employee and his or her spouse, another one for son age 21, another for age 22, and the last one for age 24. So again, each one can have their own family limit. An employee participates in a high deductible plan with his wife and children. His wife also participates in a health FSA at work. She can be reimbursed for his expenses under the health FSA, but does not submit any expenses for him during the year. Does that affect his eligibility to contribute to an HSA? And the answer is yes. She doesn't have to physically get reimbursed, but just the opportunity to get reimbursed makes him ineligible to contribute to an HSA. And this is a very common situation where each employer doesn't inform the other employer of what they're doing, and the employees don't understand this. So again, you should inform your employees, ask your spouse if they have a health FSA, and in most situations, the employer won't cut out the spouse, won't change their plan. And so if the spouse can be reimbursed for the other spouse's expenses during the year, that makes the spouse that established the HSA ineligible. And that defeats many individuals. Can a husband and wife have a joint HSA? No. They're only individual HSAs. If an individual has single coverage and contributes at the single coverage rate, can he or she reimburse expenses for his wife and children? I just got that yesterday. And the answer is yes, as long as the child is a qualifying child, that individual can reimburse those expenses tax-free. The coverage that the employee has only determines the amount of the contribution, not the reimbursements. Can an employee elect out of a health FSA before the end of the plan year if he or she becomes covered under a group health under a high deductible plan? The answer is there has to be a qualifying event. So just a change in cost and coverage is not a qualifying event to change your health FSA election. What the employer must do in that situation is amend the plan to make it a limited purpose. But just merely changing the plan, changing coverage, is a reason to change your election under a health FSA. So the employee is stuck. Stacey, any questions?
I do have one. If an employee wants to drop coverage to add onto a spouse's plan during the spouse's open enrollment, is it permissible for that employee under Section 125? That doesn't seem to be a qualifying event.
Yes.
Okay, so it is. Okay, that is all I have. Let me unmute.
The conference has been unmuted.
Any other questions? Anything? Okay.
Okay, mute.
The conference has been muted.
Who has to be provided a 1095C for 2015? Any employee that was full-time for a month. They don't have to be covered by your plan as long as they're full-time for a month. So if somebody works for you for a month, but they only worked 120 hours, no. So if they work 130 hours in a month and quit, they get a 1095C. Can a small employer require an employee to work 40 hours per week to be eligible for medical coverage? And a small employer is any employer this year that has less than 50 employees, and the answer is yes. But again, that's an ACA requirement. The insurance company may say, I'm sorry, but under the terms of our contract, anybody that works 30 hours or more is eligible. So look at the insurance contract to see what it says. If an employee transfers from full-time to part-time, when can the employer drop coverage? Now, in the past, if somebody dropped below 30 hours or 40 hours, you had to offer them coverage. The situation is different now. It basically, what you would have to do in order to terminate coverage is that use the monthly measurement method, and the month that they turn part-time, coverage could end the beginning of the fourth month after they reach part-time. So what I'm trying to say in this slide is just because somebody transfers to part-time doesn't necessarily mean you can terminate coverage immediately. Because remember, everybody is in a stability period. And just because somebody goes to part-time doesn't necessarily mean you can terminate coverage immediately. Can an employer offer employees an opt-out option? Yes. But remember, in that situation, that could be in the future that cash can be added to the amount that the employee pays to affect the affordability calculation for coverage. So they're going to come up with more guidance on this, but this is something that's going to be happening in the future. The next question is, who cannot be offered an opt-out? Is anyone who is eligible for Medicare cannot be, if you're 20 or more employees, cannot be offered an opt-out because of the fact that it's a violation of the Medicare secondary payer rules. Because you're giving them an incentive to opt out of the employer plan and elect Medicare. So please be very careful in regard to that. Does an employer have to provide an annual enrollment each year, even if those employees waive coverage? And the answer is yes. The days of universal opting out are gone. Every year, if somebody doesn't want coverage, you have to get a written waiver each year. So please, and this was very common in the past, that an employer would give employees incentive to opt out forever. You can't do that anymore. So there has to be an open enrollment, and individuals have to waive every year if they don't have coverage, if they don't want coverage. To which employees does the 90-day waiting period apply? Full-time employees. So again, what you have to do is put your employees in 3 different buckets: part-time, full-time, and variable hour. Full-time employees have to be offered coverage after completing the 90-day waiting period. Variable hour, they can wait as much as 13 months. And part-time, not offered coverage at all. When does a 60-day advance notice have to be provided to participants? If a change is made in the middle of the plan year, and it's a substantial change, then you have to give employees a 60 days advance notice. This is so if an employer decides they're going to terminate coverage during the year, get rid of their medical plan, they have to give the employee 60 days advance notice. If they decide they're going to change their employee contribution, and it's a substantial change, they have to give employees 60 days advance notice. Do wellness incentives affect affordability requirements? And the answer is yes. If it's a smoking cessation program, everyone's got to be treated as if they fulfill the requirement and a lesser premium is used. For any other wellness program, the higher amount is used. So that's how it affects affordability. Are there any additional questions?
Okay, I actually received a bunch. Okay. Can a husband and wife contribute to the FSA each at $25.50, or does it have to be per household?
It's each.
Each, okay. Regarding full-time eligible employees for 1 month in 2015 to get a 1095-C, even if they were not qualified under our plan to be offered coverage?
Correct. Even if they're in a waiting period, they still get a 1095-C.
Okay. Should the measurement, stability, and admin periods need to be listed in an ERISA wrap document?
No, but I would do it as a separate policy.
Okay. This is, can we go over the opt-out versus Medicare issue again?
Sure. Remember, under the Medicare secondary payer rules, you cannot encourage individuals to opt out of your plan and to elect Medicare. If you give employees cash to opt out, that's seen as an incentive, and therefore that would be a violation of the Medicare secondary payer rules. Now, the Medicare secondary payer rules only apply to those employees that employ 20 or more employees during the year. So if you're smaller than that, don't worry about it. But if you employ 20 or more employees, the Medicare secondary payer rules apply, which means that the employer coverage is always primary if they're an active employee. And so in that situation, they said, an employee can elect on their own to drop employer coverage, no problem. They look at the premiums, they look at the supplements, they said, well, it's much cheaper and the coverage is better than what my employer is offering, so therefore I'm going to opt out, no problem. But if the employer gives any employee incentive to opt out, and that employee is eligible for Medicare, and that employer employs 20 or more employees, that's a violation of the Medicare secondary pay rules.
Okay. Can you clarify your statement regarding those over 20 employees and how the opt-out impact MSP?
Well, again, the Medicare secondary pay rules say you can't give any incentives to employees to opt out of your program. An opt-out cash payment would be an incentive and therefore would be a violation of the Medicare secondary pay rules. So employers are going to be real careful. For those employees that are 65 or older that are eligible for Medicare, an opt-out doesn't apply to them.
Okay. During open enrollment, must the employer have to collect an enrollment form from everyone even if they are not making any changes?
Only if they're electing out of it, they're waiving. You can indicate to the employees that if they don't make an election, their choices will roll over. You can do that. But you have to collect a waiver form every year. You can't just in the past, if somebody elected to opt out once, it carried over. So a waiver cannot carry over. You have to get a physical waiver every year. That's what I'm trying to say.
Okay. When should an opt-off plan no longer offer funds to Medicare enrollees?
Immediately, now. I mean, it's been true since the 80s. You can't, for any employee that's eligible for Medicare, you can't give them an opt-out.
Okay, second part. Also, with regard to opt-off dollars, would TRICARE be treated as the same as Medicare?
Yes.
Okay. Can you please review when an employer may drop coverage for employees that transfer from full-time to part-time?
It's the beginning of the 4th month after the change in status. You can switch to a monthly measurement period. Because remember, when that happens, when somebody goes from full-time to part-time, they're a variable hour employee. And if you're in a stability period, you can't drop coverage until the end of the stability period. The only exception to that, as an employer, you decide to use a monthly measurement on that, then coverage can be terminated earlier, the beginning of the 4th month after the change in status. All right?
Okay, thank you. All right, that's all the questions I have. Before we end, I just wanted to let everyone know this will be recorded and it'll be available on our website, benefitexpress.info. You'll see archived webinars. There's a tab for that. Also, if anyone would like any information on Benefit Express or just to see a quick demo, I am happy. I would love to do that for you guys. So just you can email me at sryan@mybenefitexpress.com. And I'm going to open it up for questions.
Does everybody have any other questions?
The conference has been unmuted.
I will let you know if I can think of anything.
Hello? Does anybody have any other questions?
I have a follow-up question on the Medicare MSP rules.
Mm-hmm.
And I think that in the past, it was my understanding that if you offered an opt-off incentive, taxable cash to all employees, that was sort of the safe way to do it, and then no. So
No, that's an incentive, because for anyone who's eligible for Medicare, you can't give any incentive for an employee to opt out and pick Medicare. And by giving them cash for opting out, that's an incentive. Remember that the Medicare secondary pay rule only applies to those eligible for Medicare. So I can't see how, if you have 20 or more employees, how an opt-out could ever be not seen as an incentive. That's my concern.
Okay.
Because that Medicare secondary pay rules don't apply to someone who's under 65. It also applies to those who are eligible for Medicare because of disability or end-stage renal. But in most situations, it applies to those that are 65 or older. Okay, you have an employee 65 or older, and you offer $50 a month for opting out. How is that not an incentive to dropping employer coverage and going to Medicare? That's my question. And the CMS will see it that way. All right. Any other questions?
2 questions. One, for the 1095-C, can we mail that internally to employees, or does it have to be through USPS?
Well, the question is, how are you going to prove delivery? That's the question.
So are you saying it has to be through certified mail?
No, it doesn't have to be certified mail, but I mean, by delivering it to the post office, you're citing the fact I mean, how are you going to cite delivery, or are you giving it to someone internally that you've actually done it? That's the problem.
And then what about email as an attachment?
You have to get their permission.
Okay.
The employee's permission.
And then my other question is, when an employee waives coverage, are we required to obtain proof of other coverage? Let's say for
No.
Okay.
But you have to have a written waiver.
Thank you.
If anybody needs a written waiver, I have them. That's my contact information there, and I can send you one if you need a written waiver, because mine acknowledges the fact that they were provided affordable minimum value coverage, and it indicates that I understand I cannot elect back in unless I have a qualifying event until next open enrollment. So that's important for them to understand, because some employees say, well, I didn't know I had to wait to re-enroll. So I have that in a waiver agreement. Any other questions?
What if your insurance company wants you to use their waiver?
It's not enough. Use theirs and a waiver, because it all depends what the insurance waiver says. All right. If it doesn't contain ACA language, it's not sufficient.
Okay.
Okay. Any other questions?
I have one more question, and I apologize for beating the dead Medicare horse, but when I'm drafting an SPD, then should I call out that because the Medicare enrollees, they could be an eligible class of employees, so they would meet eligibility. They choose to waive. So if a company offers an opt-out cash in lieu, if you will, should I call out in the summary plan description then that Medicare individuals or individuals enrolled in governmental plans are not eligible?
Yes, I think you should say it, because it's a violation of Medicare secondary pay rules.
Okay.
All right. Any other questions? Well, everyone, thank you very much for your time. Again, April 5th is COBRA mistakes, and I will go into much more detail on the COBRA mistakes everybody makes. So thank you very much. I appreciate it. Stacy, thank you.
Thank you, everyone. Thank you, Larry, so much. Everyone have a great day. We'll talk to you in April
5th. 6